Hello, this is Anna Laura Brown, host of the Autoimmune Rehab Podcast, where we talk about how to actually thrive and heal your autoimmune condition rather than just covering it up with pills or changing your diet and hoping you'll feel better one day. We feature solo episodes on helpful topics and interviews with guests who have actually walked in your shoes with autoimmune disorders and/or who have years of experience in helping people to thrive and not just survive with autoimmune challenges. I'm a health coach who started this podcast because I was diagnosed with Hashimoto's in 2018 and wanted to inspire hope and transform health for people with autoimmune challenges. So keep listening and let's get you the help and hope you really need. This is the Autoimmune Rehab Podcast. Today we have a guest who has really been through quite a lot. She's been through both what is known as RA, rheumatoid arthritis, and fibromyalgia. So, you could say she really got hit with the double whammy there. So let's welcome to the podcast today, Martina, and I might slaughter her last name, so I'm not going to even try. She can self-correct it. And have you start off by introducing yourself to everybody. Who are you and what brings you on to autoimmune rehab today?
Hello, Dr. Brown. Thank you so much for having me. It is a true privilege. My last name is Ziegenben, and I'm sure you would have been fine. I
For
have
sure.
heard it pronounced so many ways.
Yeah,
So
I'm
thank you for
sure. Is
having
that
me.
like a German origin then?
Yes, it's a German origin, though I'm not German. It's after my ex-husband.
Okay. And let's clarify this. I'm not a doctor. I'm just a health coach. So, yeah,
I apologize, I didn't mean
that's
to.
okay.
But
Yeah, not at all a doctor. So, yeah. Okay. So go in and tell us a little bit about who you are and a little bit about your story.
so Yes, thank you. So I'm a rheumatologist, and it's a little ironic that or some people ask me, and I thought it was ironic that a rheumatologist gets diagnosed with a rheumatic illness. And I have two, well, actually three, but I will focus on the two. And I have been a rheumatologist for 17 years, and I have recently switched to focusing on a whole health approach to human health and illness. And I focus on chronic pain.
Yeah, and that's good because, we need that these days. There's, I think, too many rheumatologists and just doctors in general out there that don't focus on the whole health. They focus just, and they get so narrow-minded on just their little thing and their little world and, a pill for an ill type thing. And then eventually they wake up and start realize, hey, that's not really working for people. And I would imagine that part of that wake-up call came with you with your own personal diagnosis and your own personal journey.
Well, it's that's actually a good question. I have had chronic pain before longer than rheumatoid arthritis, and I have always known that there is something more to handling it, but I haven't been really good at capturing it. And it wasn't disabling or debilitating, so I just, kind of strutted along and just dealt with it. And then when I was diagnosed with rheumatoid, which was after the birth of my son 7.5 years ago, um, it was kind of more of a push. And I have to say though, I was happy just to take medications because they were helping me. And I'm still in the process of tapering my medications. I haven't completely kind of come to the other side. And that's because I have been successfully denying that what I'm doing. And just recently I started uncovering how, so in my case, it has been kind of living out of alignment with what my true wishes are. So that's what I started pursuing recently.
Yeah, that's interesting. I think, and a lot of people, I think, that either come from the Western medicine world or that just grew up that way with that attitude. That's how they feel. And it's not that having to take some medications are bad. I mean, in some cases, with some autoimmune conditions and some pretty severe illnesses, medications are going to be part of your life. That's just going to be how it is.
Right, and it's we know they work in rheumatology. Like the reason we use medications for rheumatoid arthritis is not just to decrease pain and swelling, but to prevent damage. So, um, and there are other examples. in rheumatology when utilization of medication is actually life-saving. Like if you don't use one of our anti-rheumatic drugs, people's lives are at risk. So I'm absolutely non-anti-medication. It's just that have um, I have been hoping that I can realign my life, and basically when I go back into alignment, that I can um, bring the harmony back,
Yeah.
right? So
That's good. Yeah, that's a good point. So let's head down that road a little bit then. So suppose somebody's listening to this and they have, either been using exclusively or mostly drugs for their RA or maybe even for some other kind of an autoimmune condition. What would you say would be the first thing that they should do or their first approach to take to try and get off some of those drugs and maybe start going a little bit more down the holistic route?
yes, so don't, and you're gonna get a bias of a physician, right, or rheumatologist
Yeah,
specifically.
yeah.
So I would say don't get off the medications by yourself. Don't try to taper off or stop medications on your own. Always consult your rheumatologist, because you may find out that your rheumatologist is not completely against you trying to go holistically or go off meds. They just may be more cautious, and they may suggest let's slow down. It's also important to, before considering going off the meds, to be completely, like, to have the disease in remission, meaning there is no disease activity, um, basically no inflammation. Because when you are taking medications and there is disease activity, and you take that one thing that possibly is helping to control it, then unless something else drastically changes, it's a very good likelihood that it's gonna flare. So I discourage people from stopping meds on their own, and I encourage people to, I consider myself very open-minded to patients who are reluctant to take medications. I want to work with them and meet them where they are, but there has to be a little bit of relationship, if that makes sense.
Oh yeah, it absolutely makes sense. And I'm totally with you. I mean, even though I'm not a doctor, don't come to the medical world, I would say the same thing. Don't stop drugs without, consulting a doctor because yeah, I mean that definitely can be dangerous in a lot of cases, especially if a patient's been on that medication for quite some time, you don't want to just go cold turkey and cut it without help and making
and
sure
and
you know what you're
especially
doing.
with like if they are on steroids, some patients have been taking steroids for a long time. You can absolutely cannot cut them out cold turkey, because there are repercussions that are pertaining to the body's adrenal glands and our own source of prednisone. So yeah, it's very important to talk to your healthcare provider.
Yeah.
um yeah.
Yeah, absolutely. Yeah. So what else would you say then? So once they start talking to the healthcare provider, they start working with them, what other kinds of things do you find helpful? Do you have like certain protocols as far as diet, supplements, different things like that that you typically recommend, or is it just kind of individual to the actual person?
So thank you for the question. I know that you say earlier said it's not just nutrition, but I do think nutrition is important, and I'm going to give you an example of a person who I saw recently for gout. Gout is a type of arthritis that occurs after uric acid has been elevated from the excess of uric acid, and it's most commonly affects men. It can affect women. In this case, it was a man who have had it for a long time, and he he is very overweight. So I could have just given him the medication, which we know works for gout, but
Hmm.
I had to, it was my duty to talk to him also about the fact that his weight, especially the weight around his waist, represents a risk factor for cardiovascular events, meaning a heart attack, stroke, high blood pressure, and so on. So it was, I not to scare him, just to give him information of what happens when he does, like, this is the risk you're facing. And he had significant other things going on, or he has a heart disease, and also his kidneys are affected. So it's extremely important that he focuses on nutrition and his weight, because that's what actually gonna prolong his life and make the quality of life better. This is not just a number on the scale that we are discussing. It's not just cosmetic. And because of the degree of his additional conditions, I actually suggested that he would be a good a candidate for, he also has diabetes, that he would be a good candidate for one of these medications that are used to control weight, the weight loss medications.
Yeah.
And it may strike you as, well, why do you, as a rheumatologist, why do you talk to somebody about weight loss? Because it's part of the inflammatory, like it's part of the makeup. Like when you have extra weight around the waist, not you, I'm talking, if a human has extra weight around the waist, it increases inflammation. So we decrease the inflammation by giving medications and by, changing the environment in our body. So in his case, I think he's a good candidate for the medication for weight loss because of all of these things that he has going on, like the high blood pressure, diabetes, kidney problem, heart problem. Other people who don't have all of these additional problems, who just have gout and excess weight, with them, I feel more comfortable just talking about nutrition. So it really depends on who is in front of you and what other medical conditions they have already accumulated. But the nutrition is so important to talk about because it's what we can, it's one thing we for sure can control, right?
Oh, absolutely. Yeah, for sure.
So I know that you don't like, I caught, I noticed that you said not just nutrition, but it is very important. And we do it in rheumatology. We do, explain to patients how excess weight, and I want to mention, this is not just like, there is this type of obesity, which is mostly truncal, like around our waist. That is the dangerous type. We don't talk about weight if it's the other type, and if it's just like extra skin somewhere, or basically mostly in the hips or legs or arms. We don't worry about extra weight if their overall health is okay.
Yeah, and that's a good point that you make for sure. Absolutely. No, and I'm glad you are focusing on that because, and no, I mean, I definitely don't want to, undercut and say nutrition's not important. I just, I have a tendency to focus more on the whole body where, nutrition's part of it, all the different roles that everything can play. But yeah, absolutely. And kudos to you for making sure that you are, giving those extra recommendations because I know from my own personal experience that not every doctor does that. Some of them, they just get so narrow-minded in their one little thing that they don't
Yes.
focus on the other things that a patient has wrong with them. So, kudos to you for doing that.
Yeah, thank you for commenting on it. Yeah, I take extra time, and patients, actually, I have received feedback from patients too. They tell me, you're different from other doctors. I can talk to you and you feel like real, that it's not just about medications and transaction, like here is the pill, this is your diagnosis, but I actually, that's the whole health approach. Like I'm vested in their positive outcome. So you have to talk to them about other things other than just the medication and their condition. So yeah, thank you for saying that.
Absolutely, for sure. So let's transition now a little bit. I know you mentioned as well that you also had the fibromyalgia diagnosis. So did that come like before the RA or after it, or how did that
Yeah,
play out?
I've had fibromyalgia for a long, long time, and it has been very, I don't know how much your audience knows about fibromyalgia. It has been very controlled, but it has gotten worse. I had pelvic pain on top of kind of back pain, and that was very bothersome. And that's one of the things that actually propelled me to seek different approaches to treating it. And when I had success with it, that's when I became a believer. And what I'm talking about, so that I don't talk in cryptic terms, I'm talking about mind body approach to pain. And basically, the premise of that is that brain modulates and generates pain. Brain decides how much and where we're going to hurt, and it's a very difficult concept for many patients to understand, but once I explain it to them, it's much easier than.
For sure. Absolutely. So would you say that a lot of your patients have fibromyalgia issues or other chronic pain in addition to their RA?
Fibromyalgia can be present in up to third of the patients with additional rheumatic diseases, such as rheumatoid arthritis or lupus or other inflammatory processes. And the trouble with that is that it complicates um, the picture, because when the patient comes back and they have RA and they say, I have pain here and here and here, and I feel miserable, you then, and the labs are normal, their exam is normal, like there is no inflammation exam, then the trouble is, so why is it that you have a little bit of rheumatoid arthritis inflammation that we just can't detect on exam and on labs, or is it your fibromyalgia? And it takes quite a bit of detective work, which is what we do in rheumatology, which one of the reasons why rheumatology is so fascinating and hard, and but also beautiful. And it can be hard. But so yes, to answer your question, up to third of the patients with rheumatic diseases can have concomitant fibromyalgia. And then there is a group of patients who don't have anything else, just the fibromyalgia. And I see both. I see both of them.
For sure, yeah. So how would you say your approach would be different than like if you have, say, like a patient that only has fibromyalgia and they don't have any of the other stuff going on?
How is my approach different from like approaching patient who has RA and fibro and just the patient who
Just
has
the
fibro?
fibro. Mm-hmm.
So I actually I talked to both of them about fibromyalgia the same way. Um, and so in order, and right. And when I'm not confident in saying that 100% your RA is controlled, when I'm not confident, then I spend some time on that. But when I'm fairly confident that their RA is controlled and that the pain is coming from fibromyalgia, I use the same approach, which is explaining how brain can produce pain, and how when we change our how we view pain, how it can actually change the pain perception, how we perceive pain and how we feel pain. And it's very powerful.
Yeah, for sure, absolutely. So, how do you feel like that? So, in other words, like you said, when you change how people perceive pain, then that can definitely change their life. So, what do you do in a practical sense to help somebody
Yes,
change
yes,
how they perceive
yes.
pain?
Thank you for the question. So I'll give you an example with a young patient I had a couple of years ago, who came to me with pain all over and fatigue and muscle aching, and she was concerned about lupus. And I examined her. I reviewed the studies she had had. I confirmed there was nothing else going on, and I said, so I explained to her how fibromyalgia is caused by the brain, and how the pain is generated by our central nervous system, by our brain, and how it is in response to stress. And that she doesn't have to feel stressed per se, that it's a perception of the brain that is detecting some kind of a threat. And when she understood that alone, basically when she understood that concept alone, that brain can cause pain, it's referred to as neuroplasticity, that brain changes in response to experience, that alone actually allowed her to feel better, because I confirmed for her the pain is real. The pain is 100% real, and we can see it when we obtain brain MRIs, functional brain MRIs. We can see which areas of the brain light up, exactly the same areas that are corresponding to pain. But the pain is not generated by the body, or there is no damage or inflammation going on. The impulse for pain is coming from the brain. So some patients, even when they just understand that, even that alone kind of causes them to let go of this, basically, of the pressure and concern and worrying and ruminating about pain. And when they realize, okay, so my brain produced this pain, and the next step is, so what is it? Where is the threat coming from? But it's not really important to necessarily figure out where right away, because some people may not be. Some people know right away. I've had patients who immediately, when we just started discussing her situation, she's like, I know what it is. I know what it is. She had a son whose ex-wife took the son away and basically flew away to Texas with him. The son was small, and she was so worried about her son. And when we talked about how she cannot control other people and how that stress can cause her brain to generate pain, she had 80% improvement within 2 months. And the other things we were working on is basically teach your brain to feel safe. How can you teach your brain to feel safe? And there are techniques, self-compassion, self-love. There is a method called somatic tracking, when you bring attention to your pain on purpose without judgment while sending safety messages to your brain. And then there is also the method of becoming aware and expressing your emotions in a healthy way. And then there is obviously the CBT, the cognitive behavioral therapy. So I teach patients all of that, like not in one session, but one by one, I explain that to them, and they choose which one of them resonates the most. And that's the one they choose to pursue. I have to say, for me personally, I use combination of both. For me personally, all of these work. So becoming aware of my emotions and expressing them in a healthy way, becoming aware of my thoughts, learning how to make myself feel safe, the self-soothing, and believing, like having belief in myself that my body and my brain, that we can do it. We can figure out how to we can achieve the goal of decreasing the pain.
That's good. That's awesome. Yeah, because I think a lot of people just don't either realize or they don't recognize the role that your brain and that your emotions and your stress and all these things can have with your pain level.
They did a study. So they had a group of patients who had recent breakup, and they recruited them into a study. And one part of the study was to show them the picture of their ex, and they asked them to think about all the ways this person hurt them. And they did brain MRIs. The second part of the study was they produced pain by heat, by touching their arm with heat probe, and they scanned their brain MRIs. And it was so fascinating to find out there was a huge overlap between what areas of the brain lit up with thinking about the ex and while they were in pain. It's so that we know that emotion processing is very connected to pain processing, like physical pain processing. And that's why addressing emotions works for decreasing pain long term.
Yeah, that's interesting. That's awesome. Well, that's great. Well, we've learned a lot, I think, already here. There's a lot to unpack. Is there anything else that I didn't ask you that you wish I had asked you?
uh, you were quite comprehensive, and there is so much to learn about brain, and it's just, I encourage anyone who has chronic pain or chronic illness not to succumb to kind of doomsday scenarios. Basically, our brain is capable of amazing things, including improving the pain, almost no matter what the cause is, but especially if it's generated by the brain. Sorry.
Yeah, that's great. Okay, so now the last question that I always like to ask everybody is if you could go back in time to however many years ago, before you had your diagnoses, before you started having all your pain, that kind of thing, what is one thing that you would tell yourself that you know now that you didn't know then that you wish you would have known?
This is such an excellent question. And what I would have told the young Martina is that just stop and breathe. Put a pause between whatever is irritating you or whatever is just whacked you. Stop and breathe and give space to your thoughts, to your emotions, and you'll be able to figure it out. It's basically slowing down the reaction, slowing down the thoughts. That's the biggest lesson I have learned over my 49 years.
That's awesome. That's great. Just slow down, relax, and breathe. I
Oh,
love that.
right.
Okay, so where can people connect with you? Go ahead and tell us verbally, and then we'll make sure we have a link to it in the show notes if somebody wants to reach out and contact you.
Okay, thank you for giving me the space and opportunity. I have a private practice called Whole Health Rheumatology of Cape Cod. I don't know, it's my background, Whole Health Rheumatology of Cape Cod, and the same website, basically Whole Health Rheumatology of Cape Cod. I have a contact link, and I'm also on Facebook, the same name of the practice, Whole Health Rheumatology of Cape Cod, and I am very responsive to messages. If they contact my practice phone number, which is on the website, we usually respond, within hours. So whether they want to become my patients or if they just have questions, because I'm still new, I'm still very responsive and growing my practice
That's awesome. And do you do any kind of like virtual appointments at all with people that don't live in the area, or are you mostly just a hands-on, come see me at my
I'm
clinic?
hands so I can do virtual appointments for people in Massachusetts, and I'm working currently on getting additional licenses. It's not going to be in the next 2 months, but I this is a long-term 1 year goal to obtain licenses in another 15 states.
Awesome. Cool. So eventually maybe people in other states will be able to work with you too. So that'd be cool. But yeah, in the meantime, we'll make sure we have your information below. And thanks so much for coming on and sharing with us. And for those of you that are listening to this, if you enjoyed this or found it helpful, please share it with other people. Please feel free to rate us, write us a review, and send on any questions or feedback that you have for us. We would love to hear it. This has been the Autoimmune Rehab Podcast.